Hi, it's Jeff Cohen from the Florida Healthcare Law Firm. I'm here today with my buddy Carlos Arce, the consigliere that worked hand in hand with our featured guest, Dr. Anjan Patel, founder of Asaar Medical, one of the only licensed ACO REACH programs in the entire country. You're going to want to watch this one. Thanks so much for joining us. We've wanted to do this, and we were talking about this when we were just hanging with you at the office, and we're like, we got to get this guy on camera. We'll have great conversation. So thank you for coming today and taking the time. Appreciate it.
Thank you.
I've got to ask you the most important question, because we've distilled down, because I know your history from talking to Carlos. And I'm like, we got to ask the most important question if we do anything at all. Here it is. Like, what's your favorite music?
My favorite music is usually top 40 and some country music.
I do. Really?
Yeah.
Are you a Tyler Childers fan?
Actually, not a big fan.
Who do you follow?
That I don't know. I don't have a particular artist. I just put on the channels and on Spotify and just go. I don't even know who's in what.
Yeah,
just follow the music. So
that's a lot of So give us a little bit background. Like, where'd you grow up?
I grew up. I was born in Africa, actually.
Where?
Zambia, yeah. And then I moved here when I was 10. I grew up in New Jersey mainly.
I'm sorry you hear that. Mike is
not that bad of a place.
Right.
But, and then moved to South Florida after I finished residency in 2013.
Where in South Florida?
I moved to Boca Raton.
No kidding. I didn't know you started that.
That's great. I started my office back then, right after residency.
What were you doing initially?
Primary care practice, family medicine. That was my residency program. And I started a small little office and started working at the hospital as well, taking admissions, etc.
So when we look just back up a little bit, when you were in New Jersey, you moved here when you were about how old?
When I was 32.
No kidding. Well, so what was life like in your house growing up? What was that?
It was difficult when we moved to the U.S. Very difficult. My parents had lost everything financially. We moved into a one-bedroom apartment, 5 people, and then definitely from there, grew up in a motel. So, have you seen Sheets Creek? I mean,
yeah,
in Ireland, similar to that. We were in a motel. My dad bought a motel, and that's how I grew up. He put us through school while we lived at a motel.
That's remarkable. What inspired them to move to this country?
There was a military coup in Zambia at that time, and so there was devaluation of money. So my dad had to sell his company, move to the U.S., and a devaluation happened during that same time where he lost all his finances and during the move. Yeah.
Did you experience a big change in lifestyle when you moved from Zim?
Yes, because we were. My dad was very well established in Zambia, and when he lost everything, it was a huge shift in lifestyle.
How old were you?
I was 10.
Wow. What do you remember about that first time of landing in the hotel and all that?
It was actually when we went to the apartment and an apartment to the hotel. It was like happiness. We have a business then.
Right.
So my parents have a business. We have a better place to stay versus the one-bedroom apartment for 5 people.
What was that?
It was hard. Because you had 2 older sisters and my parents had to sleep on the floor.
Yeah.
Not enough beds and stuff like that. Yeah. So 3 years we were in an apartment.
Do you remember how you felt when you were in that apartment?
I felt I was just seeing other kids going out playing with classmates and etc. I always felt like they had stuff that I did not have, like the new Air Jordans or any kind of play sets of anything, you know?
Yeah.
And they got to play team sports when we didn't have time or money to play team sports.
How did you respond to that? How did you guys respond to that? I mean, you're new to the country. You come here. You don't have anything that the people around you had. You had it when you left the country that you came from. You're here. How did you react to that?
It was hard. Sometimes I used to cry to my parents, and then after that, you just get over it. You just go out and play with the friends, make friends, go out in the yard, and we lived in an apartment complex, so it's just go out and play with all these kids that live there, you know. But essentially, it became natural. We get used to it, and then we basically see your parents working very hard, and then that motivates you to help them.
Is that what you saw? Your parents working real hard?
Oh yeah, we'll work 24/7 in the motel. I helped, me and my sisters helped. We helped clean the rooms, do the laundry. I helped with all the maintenance, everything in the hotel.
Can you share with us, like, when do you, being in that situation, and you're now in the hotel with the promise of the future, when did you start to feel hopeful?
I started to feel hopeful after like a year, 2 years into the motel, because we got flexibility on finances. Whether get a new car, or we're like so happy that we got a new car, or travel to India to go back, visit family back home, and you could afford the plane tickets, all that. So,
that's a big change.
Yeah.
Yeah. So I'm curious, what were you thinking at that? I mean, you're a kid. You're what, 12 years old at that time, 13 years old? What are you thinking you're going to do with your life at that age?
At that time, I knew education was the only thing I have to get myself out of everything. So my parents always promoted education. They always said education is the key. Even see what happened to us. We lost everything. But if you have education, even if you lose everything, you can still get a great job and financial capabilities.
So that was really hammered into you by mom and dad?
Oh, yes.
Yeah. And so what were you thinking you were going to do?
At that time, I was basically thinking I was going to be a doctor or engineer.
Wow.
So
you realize that's a really remarkably ambitious thought for a young kid, right?
Yeah, I loved engineering. I loved aeronautical engineering. I was really good at math and sciences. So therefore, that was my first choice that I was going to go into. That's incredible, guy. So physician was not until later on that came about. But the first
What was that?
my last year in undergrad is when I decided to go to medical school. I was in the engineering program, a computer and software engineering.
And so you're a total academic slacker.
Yeah.
Engineering, are you kidding me? Holy shit. That's amazing.
Yeah, and then last year I decided that I want to transition into medicine. It was I was part of a co-op program where I worked for 6 months, went to school for 6 months. It was a great experience, but it was just not my forte to sit in front of a computer for 40 hours a week. So even though I liked it, but it was just a desk job. So I'm like, I need to do something I could interact with people, and that was being a doctor is one of those professions where you interact. You're not sitting at your desk. You're moving around.
Did you get people that your folks think that was a good idea and they support you that idea?
My dad originally said no. It's not a great idea. I mean, he loves education, right? He's like, you could be successful. You could become a patent attorney in engineering, or etc. Why do you want to make your life so difficult going through medical school?
And your response to that?
Well, I think it's going to make me happy. So that's where it was all fine. And
Isn't that funny? Though, that's always the most important thing. If you follow what makes you happy, you end up in the right thing.
oh yes,
But I love the story of the challenge,
Yeah.
and the fact that he didn't make it easy on you. He pushed back.
oh yes.
Yeah.
He pushed back. He definitely pushed back, and but it was he realized after a few years of medical school that it's the right choice, and they always supported me. They do. They paid for tuition. They helped pay for all my tuition, So
Wow.
I was supportive of it.
That's fantastic. So you're a practice for how long before this magic that we're going to talk about happened?
So I started practice in 2017, and essentially I was part of my primary care office, and then 2017 and 18 is when the idea for the MSO and value-based care came about.
What were your thoughts? Because this is, for a lot of the folks that are listening, they're not going to understand what any of that means. So what was your thinking at that time that translated into that?
What the thinking was, there was a lot of pushback from insurance companies trying to sign you to get contracts. So my biggest difficulty was getting insurance contracts. They always said you have to go through a value-based company, like an MSO, managed service organization, to get a Medicare contract. And when I did call them, they did not extend any Medicare contracts to us. So essentially, my thought process was, why not start your own MSO and your own value-based company?
Really? That's remarkable. Because you realize that's an unusual thought process for a physician to say, I'm facing this challenge, so I'll just form my own company.
Yes, and that's where...
I mean, I don't want you to skip over that. That's freaking weird and unusual and uncommon.
It's very uncommon, and when I first started, there was physicians, they're like, we've been trying to search for this contract for 20, 30 years in practice. How did you manage to get one? But like, I had my goals set. It's like, when I can't get something, I will achieve it somehow.
I kind of get that from you, because you come here, you face the challenge, and every time you face a challenge, you push.
Yes.
That's a remarkable quality.
That's why the answer no is never in the equation. I always find a way to get my yes.
So where did you see that around you? Did you see that kind of personality and that kind of commitment around?
My dad, hard pusher, business-wise too. What he did, ended up working very hard in Africa, seeing him how he grew from $7 to a multi-million-dollar company in Africa, and then go back down and then come back up. And so it was like, no was never an answer. He's like, he worked to get to the goals.
And so here you are now, you're in whatever year of practice, and you decide, in response to the obstacles of getting on panel with insurers, you'll just form your own company and you'll bypass that whole problem.
Correct.
How did you learn how to figure that out? How did you figure that out? I know you were part of it, but how did you guys figure that out?
Well, originally when Dr. Patel first got the license to have an ACO REACH, back then called the DCE, I remember he already knew and understood the business of MSOs. So let's clarify what we mean by MSOs, because I think there's two forms of MSOs. There's an MSO that's ultimately like a third-party administrator for Humana, Aetna, AvMed, which basically what they're doing is they're a gatekeeper to a contract under a Medicare Advantage plan. And what they're doing is they're allowing providers to work in a network with them, and they're helping them manage risk, coding, billing practices, things of that nature. The MSOs that are very common in our industry are management companies that manage, let's say, provider groups who are used in the friendly physician model, where there's states of corporate practice of medicine restriction. So let's identify what we're talking about here is, he already understood all this when we first met. So it was, my background's in business and healthcare, so when I met him, we kind of just hit it off immediately. It was almost like, finally, someone that understands what we're talking about here. And he didn't need clarity. He was ready. He's like, I have this program. I want to get it going. I want to be compliant. I want to be legal day one. How do I do that?
Where'd you guys meet? How'd you?
It was a phone call.
Really?
He called me. He said, I heard about your name. I asked about a reference, a lawyer that may understand value-based care and insurances, and you're the guy. So he calls me, and I'm like, all right, let's talk.
Were you the guy?
I mean, we're still doing it.
So, I mean, at the time that he called you, were you actually the guy?
Yeah, I actually understood what he was talking about, and I knew exactly the struggles. And when I heard from him that he was doing this, I said, this is crazy to me. I was beyond amazed that he got the license, number one, and that he was going to do this. And I said to him, are you ready to compete? Remember I told you, are you ready to compete with Humana? Are you ready to compete with AvMed, Florida Blue? Are you ready for that? He's like, I'm ready. Let's do it. And he's a yes guy. Mm-hmm. So I said, you're going to fight billion-dollar companies. You understand that, right? He's like, nope, we're doing it. I said, I'm all in.
What year?
This is 2018?
Or 2020 is when I got the acceptance.
So it was 2019 because you were already
I was prepping. Yeah.
You were talking to me. You were like, Carlos, I need you to become versed. So we got all the legislature. I started going on all these chats with CMS and listening, and he was going on the chats with CMS and listening. We were both learning, teaching it to each other, reading the documentation from day one. We were like at the front of it, the frontier minute.
So for those who are listening, this is just about 4 years ago.
Yeah.
About 4 years ago. Can you help me understand, about 4 years ago when you have this idea, you partner with Carlos, you're like, let's go for it. What's your situation? You have like millions of dollars of free cash available, and what's the situation?
I was just paying bills.
Yep.
I was just trying to get the house going.
Yep.
Just to pay. Even though a lot of people think physicians make a lot of money, in the grand scheme of things, with the cost of living, et cetera, you're not. You're still living paycheck to paycheck, especially a primary care physician.
Yeah.
So it's just basically paying bills, making sure I have food on the table, the house is being paid for, and we have an automobile.
So with this vision that you have in mind, this ACO REACH program platform that you're going to create, which is new, how much did you figure you'd have to come up with to do that? Did you go through that analytic and come up with, I'm going to need to figure out how to get $1 million or 500,000 or whatever? Did you do that analytic?
We did the analytics in the beginning.
Yeah.
But as the program, when it was first introduced, there were some changes as the program evolved, because it was a brand new program.
Yeah.
So those initial analytics was way different than what transpired. So we did have to secure millions of dollars of credit backing, which we successfully did.
So how'd you do that? How do you get money when you have no money?
That's the secret sauce. That's the negotiations. Dr. Patel is a great negotiator. He's a business person, and he can get in a room and cut to the chase and understand numbers. And that's what I love about him, is he was figuring all this out by himself. He'd just come to me and say, Carlos, I got the deal. Here's the contract. Where are our exposures? Let's get it done.
But it's funny because
it was done.
I can imagine, though, the look on some lenders' faces when you go there. You're like, who are you? Well, I'm a guy in practice. How much are you making? Not a whole ton of a lot. What do you want to do? I want to create something that hasn't been created before, and the licenses are incredibly constricted, and I have no experience operating that business anyway. But I want millions of dollars from you. I can imagine that a lot of lenders would be going, who is this?
Yeah, they laughed.
Yeah. I remember you calling me and like, oh, that guy, douchebag, that guy, and that's exactly the word he loves, douchebag. I'm like,
I love it.
Well, gotta keep going. And he's like, all right, I got meetings stacked up, and he's relentless.
Were you in those meetings?
No. He does all his negotiations on his own. I get looped in once. It's fairly solid.
So what was it like in the room?
I had an hour.
You were getting no's, right?
Yeah. It was an hour meeting with a billionaire, not even a private lender. So essentially, their value-based company needed help getting this contract. They didn't have the contract. So basically, the value proposition was, I teach you, I need the money. So it was a handshake deal. They backed up my company, and I helped them create entity. And now they went on being over a $600 million company, and probably going to be over $1 billion company within the next year. And I helped spearhead that.
So you found somebody who had the foresight to recognize your value, to know that you would be helpful to them, at the same time that they're simply providing cash support for you. Correct. So they fund you and you teach them.
Correct.
remarkable exchange given the fact that because of your education, they got $1 billion company.
Correct.
Remarkable. And you got the fuel, the financial fuel, to create something brand new that hadn't been created. And they bet on you.
Correct.
Tell me about who made that decision. Was it the lender himself, the billionaire that you mentioned?
Yes.
And did you have a relationship with this guy for a long time before you had meetings with him?
First time I met him, and after an hour meeting, we had a handshake.
Unbelievable.
Yeah.
What do you attribute that to?
Being honest. I laid the cards out on the table. This is what I have. This is what the value. I was in my scrubs in my back of my office on the Rubbermaid tables in the back. And that was our meeting.
Remarkable.
Yeah.
Remarkable. He just believed in you, and you were authentic, and you were honest.
Correct. And that's what he looks for. That's why he's very successful, is because he has a lot of healthcare ventures, and they're very successful because he knows how to read people.
Yeah.
Beautiful. Yes, quite a story.
Oh, it's amazing.
If that's all we got from this episode, that's remarkable. You know, people talk about the tactics and they talk about how to, you know, and it's very physical and it's very tactical, if you will. But people don't talk about this stuff, you know, the nuance and the personal and, if you will, the energy of it, you know, the authenticity and the ability to look somebody in the eye and to be honest and to be vulnerable and authentic about it. And somebody just has a feeling. I mean, that's what has him go over that waterfall with you. It's just like, I'm in with you. We're in it to win.
Yes.
Are you in touch with them, Nick?
Oh, yes. They, as my treat on my handshake deal, I said, I want to ride on your private jet because I've never been on one. So
I remember you told me that you were going to do that.
this year they flew down, took me on the jet, and went to the TV. Then we met up in Europe, saw Wimbledon together.
Can you give us a flavor for what you've created, what it looks like now, and what your life looks like now? By the way, 4 years after you have this crazy dream.
Well, what I've created is something out of the ordinary, competing with very large organizations. I think we have a niche. I have a personal relationship with every physician that's in our group, which makes us our niche. There's no CEOs of any of these value-based companies that actually reach out to any of these physicians. They don't have a communication channel. My channels are being direct. I go fly to every city that we're in, and it's been very successful for us. We quadrupled the size of our providers within a year, and going into 2024 and then 25, we have huge projections going forward. We're highly successful with Medicare and showing shared savings. We have great management systems, care management team, to basically also a great coding team, reviewers, etc. So that helps drive the value-based care model. Essentially, we look out. We never put any patients on compromise. Of course, there's some, when you hear about value-based care, you're always thinking about, are you taking away care from the seniors? We're actually providing more care to decrease utilization. So that's the beauty of what we do. And that's why I'm so proud of it. Life since has changed. I practice, I slowly dwindled down to practicing only once a month just to keep active in the medical field. I run the major operations at Asaar, and now very financially stable, and loving it.
Tell me about, are you comfortable sharing ballpark numbers of what projections is?
Projections in terms of our first year shared savings is projected over $18 million. Next year shared savings for 2024 with our analytics team, we're looking at $20 to $30 million in shared savings in 2024. with our roster and lives. We're going to be well over 20,000 beneficiaries in our model going into 2024.
Like, I'm curious. I don't think I asked this, but what, if you can distill it, what was your why when you were at the planning table for this cover? What was your core reason? What was your why? What was driving?
What was driving me is when I was sitting down with my consultant to get into this model, we were looking at competitors in this space and what they're not doing right. And the why was the care that the seniors are not getting. Meanwhile, they're just looking at profitability. So that was the main reason of the why, and how can we improve the quality of their lives as well. But because improving their quality of their lives will decrease the spending in the first place. So that was the main why as when I entered into this.
How about now? What's the why now?
Now it stays the same, but now it's we've reached the company to a different level, and we plan on expanding. We are speaking to payer networks that want to come and be part of Asaar and extend their contracts within our network.
Where do you think, if you could imagine, where do you think you go with this at this point? What's the future?
The future looks like very bright. We want to create a solidified company. We're planning to be in over 32 states. We want to cover the whole United States, and that's our future. And at first, when we covered 20 plus states, it was like a dream come true. Now, I set my goals higher and higher every year.
Yeah. Tell me a little bit, if you would, about working with this guy. I know he's been involved for a long time with you, but I'm just curious to know, how is that working with Carlos? And I'll ask you to sign.
Well, it's been great. I do a lot of lawyer shopping because healthcare law is very complicated. It's not easy. I've seen situations where a healthcare attorney has put me in the wrong direction, and like in the extent of law, because you got to be knowledgeable about the law for them to execute on something. So when I spoke to Carlos at first, his understanding was very high IQ on the healthcare side. And even if he didn't know it, he would go research it and make sure we're in the right path. That's why it's been amazing working with him. Call him anytime, he'll answer his calls. Response was never an issue. So that's been great.
How's it been for you? We got a buddy at him.
Yeah. You know, his vision for healthcare, which is what he was talking about the patient gets better access through more exposure. That, coming from the healthcare background, being in the space, that was my dream too. I wanted to be a physician at first. So in me being a lawyer to a physician who's become a friend, I get to play with him in that realm where we get to, I feel like I'm with him on the ride, and I'm helping him, and I love what his vision is because that's my vision too. So like we've aligned and we're synced in. So working with him is a blessing because not only does he understand the medical part, but he understands the business part. And when I explain to him things on the legal perspective, he doesn't, when I tell him this is how it is, this is what we have to do, he's like, okay, and then that's the way it is. He's not that kind of guy that's going to say, well, I don't care, we're going to do the wrong thing. You know, that's not him. He's got a moral compass. And I have a lot of clients who don't become clients because they ultimately challenge that and they don't want to hear that. And he's like, compliance is first. The legal is first. Because that's the way we keep this successful. The patients are successful. The doctors are successful. And he cares about the doctors. That also sets him apart, is that he genuinely puts them first. When he's negotiating, I always see it. His inclination is always, well, don't screw the doctors over because they're the caregivers. Because he's thinking about where he's come from. That is beautiful to me. I love it.
Can we let's for a minute, let's switch gears with this a little bit. Let's talk about the dark side. Talk about the dark side. I want to hear a little bit from you, if you guys could share, about people who didn't want to see you succeed, the people and the things that seemed insurmountable. talk about that for a minute, if you would. Because I assume that you had people that you faced that didn't want you to succeed, that might have been jealous, that kind of thing. Could you talk about that a little bit?
And that mainly occurred in the local area where I was practicing. A lot of the physicians that have been there prior to me saw my success as threatening. They basically, when I asked them, like a friendly ask, hey, join our network, it was always a no. It's if he can do it, we can do it. And essentially, that's what their thinking was. As I grew, they became more distant, and I distanced myself from negativity. So anyone that's negative, have bad wishes for you, I step back a little bit from them. Yeah. Of course, that happens in your local realm of physicians in the area that you work with. So that was our dark side. You lose some friends.
Yeah.
Did you see Anjan come under attack?
Yeah. A lot of jealousy for him. At times, even discrimination.
Really? I hate to get into it, but that.
No, I want you to.
No, we had doctors who were haters, who just didn't. They couldn't understand how this guy, who was an immigrant to them, how he was doing better than them, and it was disgusting. I took it personal because I had the same problems growing up and the same problems becoming a lawyer. I've always had that problem too, where people they look at you less because you're not American or white. And
what, do you grow up like really wealthy people?
I grew up like him.
Yeah.
In a house with like 8 people and 2 bedrooms. So I have a similar background, very humble beginnings. My parents unfortunately couldn't get a business, but I've paid my whole way. I paid my undergrad, I paid my law school, and that when he was under attack at times, that to me was like personal. Yep. Because I'm like, I got to be there for him.
Right. So what
F them. Right. We're coming for them. Right. We're going to be better. And you remember what I'm talking about.
Yeah.
You know what I'm talking about. So we're going to talk about names.
I get it. Biggest challenge that you remember, aside from the funding thing, which by the way, for most people listening, that's probably their biggest challenge in their mind. It's like, I have no idea how to get money and nobody will fund me, and so I'm just not going to do it. Obviously, that wasn't your biggest challenge because you just explained how you walked right through that. What would you call your biggest challenge when you were creating this?
Well, it was a challenge for the funding. It took me a while to find that. But the biggest challenge, I think, was trying to find believers. Everyone that I spoke to about this project was like, oh, it's not a great idea. You're too much risk, or it's just a bad program, or just negative, or they just weren't willing to join, be part of us. So my biggest challenge was gaining provider trust in the beginning, just to be part of our program, because we needed a minimum threshold of 5,000 lives, Medicare beneficiaries. So initially, that was a requirement, but getting these trusts from these physicians was hard. That was the hardest challenge in the beginning. That is less of a challenge now because our success speaks for itself. Yeah. So the physicians do trust us, but our initial physician group, I'm very good to them. That trusted me. So that was the biggest challenge, is getting the trust.
And by being very good, I assume what you mean is that you're financially generous and you look out for them to make sure that they're having well compensated.
Correct. So all our physicians are very well compensated. We're highest in the industry. The reason is I'm a physician, right? So I can speak for myself how we burden ourselves day to day with paperwork and all kinds of stuff with reimbursements getting lower and lower. We make sure our physicians are top tier reimbursements, not only with reimbursements, the shared savings and how we share our shared savings. Our top line admin costs we don't have private jets or yachts and stuff that we spend money on and take it out of the physician's pot. we share back shared savings back to the providers in a fair fashion. So all our physicians are very well compensated and very happy.
You know, to what he's saying, I just attended the fraud and compliance seminar up in DC from the American Health Law Association, and CMS was there. And I told him, I said, CMS said that by 2030, every Medicare patient will have to be either in an ACO REACH program or in some sort of value-based program. Think about that for a second. Fee-for-service is going to go away. So if you're not part of a network like this, where you're getting helped, you're going to have to be to basically the scrutiny of the insurance companies. So I think this is a very nice pivot for a physician who doesn't want to be beholden to an insurance company. They can work with a physician who can reason with them, and he can reason with them, and they speak the same language. So from what CMS is telling us, it's a good time to jump into one.
Did you have times when you were creating this where you thought, this isn't going to work? And did you ever have a moment where you thought, maybe I should give this up, I should quit?
There was a few times where when we struggled with gaining enough lives on board, we deferred the contract for a year. Instead of launching in 21, we launched in 22 because of that. The number one reason was lives plus funding. So my thought process was like, is this really going to work, you know?
Yeah.
But I stuck to it. It's like, I'm not a quitter.
Is there anything or anyone in particular that in that moment came to mind or were inspired to help you get through that, Matt?
I think the inspiration came with it. My parents are always supportive on anything I do, but they're always on that be careful side of things, meaning they don't want me stressed out. Right. So they're like, just be a physician. Don't stress yourself out too much. But for me, it was just I basically inspired myself and to get it done because I know where I wanted to go.
Remarkable story to be have. I mean, honestly, just not just from a professional perspective, but I didn't know you as well before this, and I'm incredibly respectful and really admire who you are and how you roll and why you do what you do. It comes across a lot that you care very much for patients, frankly, at my parents' age, and that you care about your colleagues a lot. And I think that that's something that a lot of people don't get to see because you're in business mode, what have you. And I'm really grateful that the people who watch this will get to know you better because you're a cool guy.
Thank you. Appreciate it.
Thank you.
Thanks, Jeff, for having me.
Thanks for joining us.